Welcome back to the show. I have the pleasure of being with Dr. Beth Cunningham, who is an ophthalmologist from Omni Eye Specialist. Dr. Cunningham, welcome to the show.
Thank you for having me.
Great. Well, before we jump into the topic for today, which is about general eye health care, I want to know a little bit about you. Tell us a little bit about your background.
Okay, I'm actually from Baltimore. I grew up just a few miles from here and went to school here, different locations all throughout my life. And then I went to Georgetown for medical school and for my training in ophthalmology. And then came back to Baltimore, and I've been working with Omni Eye Specialists ever since.
Now, what's the difference between an ophthalmologist and an optometrist?
I think you're thinking an ophthalmologist and an optometrist. An ophthalmologist is an eye specialist who goes to medical school and focuses not only on eye disease but also eye surgery.
Okay.
An optometrist also can treat eye disease, and they also have extra special training in glasses and contact lenses and that sort of thing.
Okay, I see. So they're the people we go to get glasses and contacts and things of that
In large
nature.
part, like in your
Sure.
community. Yep.
Now, what drew you to what you do today?
To ophthalmology?
Yes.
Well, when I was going through medical school, I actually thought I was going to be a family medicine doctor, but I really liked surgery. So I started to look at the different aspects, different kinds of surgery. And ophthalmology allowed me to do some surgery, but also had some components of family medicine in that you see people routinely and regularly for their eye problems, so you get to know your patients well and that sort of thing. So it had a good combination of both.
You just wanted to stick a needle in the eye of sorts. I understand. Now, your family, are they also in Baltimore?
Yes, yes. My mom is right over in Parkville, and we all live basically within probably 30 miles from here.
Very good. Well, let's jump right into the topic for today, general eye health care. And when I think of this topic, I'm thinking about various items like cataracts, macular degeneration, all of those things. We can start with cataracts, though. What is a cataract, and does it have to be mature to be removed?
A cataract is a change in the clarity of the lens of the eye. When a lot of people learn that they have cataracts, they think a lot of times that they have a new growth, that something's developed in their eye. But in fact, it's not a new growth, it's just a change in something that's naturally already in the eye. We all have in our eye a lens. It's behind the pupil. In this picture, it's right here. The pupil is the center part of your iris, which is the colored part of the eye. And the lens is like a piece of glass that you see through. And when you're a baby, that glass is crystal clear. And then over time, as everyone gets older, that lens, that glass, no longer is clear, and it develops clouds and a yellowish change, and then we call it cataract. People often ask me when I see them, do I have cataracts? And the truth is, if you're over 65, yes, pretty much 100% of the time, you have cataracts.
Now, people can generally tell if their vision gets cloudy?
To some degree. So when we say that you have cataract, it doesn't necessarily mean you have to do anything about it. We do something about cataracts when you're starting to have symptoms. And that leads into the idea of, does a cataract need to be mature? That's sort of an older term we used to use. And actually, a totally mature cataract would mean you're basically blind from the cataract. You couldn't see your hand waving in front of your face. So these days, we don't wait for a cataract to become mature. Instead, we look, and if we see some of these lens changes, and in combination, the patient is saying, oh, I can't see as well, or I'm having trouble with my night driving, seeing halos around things. Those are all indications that it's time for your cataract to be removed. So it's really a decision based on what your doctor sees and how you feel about your sight to decide if it's time for your cataract to be removed.
You mentioned symptoms a little while ago. What are some symptoms?
The main thing can just be generally, overall, my vision is weaker. It's more blurred. I don't see as well. And then the other symptoms are glare, halos, and trouble with night driving is a big complaint.
Now, when we're talking about removing cataracts, what what are we talking about here? Are we talking about surgery? So surgery is the only way to go?
Surgery is the only way to remove a cataract. There are drops that are able to be purchased at like a CVS or a Rite Aid that will suggest that the drop will get rid of your cataract, and they're just totally stealing your money. It doesn't work at all. The other thing
That's
that
a
people
very good point to know. I'm glad
Yeah.
you said that.
The other thing, a lot of people think that a cataract can be treated with laser, and it cannot. It has to be removed surgically. Something we'll probably talk about in a little bit is there is a subsequent laser that some people get after they've had their cataracts removed. But for the initial removal of a cataract, it has to be a surgery. It's still a pretty minor surgery. It involves a very teeny incision that doesn't usually involve any stitches. That breaks up that cataract or that lens. It's like a marble, and you take an ultrasound and you shatter it. You shatter the marble, and you suction the pieces of the marble out. And then you take, it's not that bad.
We're alive or are we sleeping when we're...
You're numb.
Okay,
so
great.
That's the most important thing.
Okay, good.
And then the new lens is folded up like a taco, and goes in and kind of opens up down here. This is what a new lens would look like in a person's eye. And all of it's done through this little incision that usually requires no stitches and only takes about 15, 20 minutes. It's very safe. People of all ages, we have people who are 100 who have their cataracts out because it's a pretty safe procedure for your eye and your body.
But this is where you step in as the surgeon to do this procedure. Generally, how long does it take again?
Somewhere between, I guess it could be as short as maybe like 7 minutes to maybe 25 minutes. So there's a range there.
And then I'm just curious to know, what was your youngest patient to work on to get cataracts?
Well, I myself have operated on someone as young as 18.
Wow.
But you can actually have babies can be born with cataracts.
Now, is that an
so,
injury or a disease, or that's just what it is?
you can have congenital
progressed.
cataracts
Okay.
that you're born with. Now that's an uncommon cataract. Most of the time they develop over the age of 55 or 60.
All right. Well, I'm chatting with Dr. Beth Cunningham from Omni Eye Specialists, and she is an ophthalmologist, and today we're talking about general eye health care. When we come back, we'll be talking a little bit more about general eye health care as it regards macular degeneration and a few more other factors of the eye. You're watching Good Morning Oakcrest right here on WOCV Channel 19. Stay tuned. Welcome back. Today we're talking about general eye health care, and today to share on the topic is Dr. Beth Cunningham, who is an ophthalmologist from Omni Eye Specialists. Now, Dr. Cunningham, before we went to the break, we were talking about cataracts. Now, a question arose as we were talking about that before we move into glaucoma is, can cataracts grow back?
No. Once your cataracts are gone, they're gone for good. They don't come back. But what I was alluding to before, that there's a laser that can be done after the cataract is removed, is why some people can get confused that laser treats the cataract initially. What can happen is the new lens that you get in your eye is held in place by a bag. It's kind of like a piece of saran wrap. And that bag can actually get a little cloudy, get a little wrinkly. And so about 30% of people after they have cataract surgery get a touch-up laser. And that laser will eliminate that bag and restore clarity that you may have started to lose years down the road after your cataract surgery.
Okay. Well, anything we've missed out on cataracts before we move on to glaucoma?
The only other thing that's probably worth mentioning is that there is a new development in cataract surgery. What used to be the standard for cataract surgery is you get a lens called a monofocal lens. And what that is a lens that eliminates your cataract, helps you to see well, but you still need your glasses for most of your activities. There is, the past few years, a new opportunity called a multifocal lens. And this is a type of lens that, when placed in the eye, not only eliminates the cataract, but can give you greater freedom from glasses. It's at an extra fee, so it's not for everyone, but it's an option now.
It's just like having laser eye surgery.
Yeah, it's kind of like
to
getting
clear
that
up.
done in a way at the same time that you're getting your cataract taken care of.
Wonderful.